Hi, in this video, I'm going to talk about five top most good practices or tips to help you prevent recurring UTI in women. But before we go to the five, I would like us to just have a brief summary or understanding about UTI. So, UTI is an abbreviation of urinary tract infections. So, what are urinary tract infections? By definition, we are saying it is an infection affecting any part of the urinary tract system. The urinary tract system includes the kidneys, ureters, bladder, and the urethra. What are some of the symptoms that you will be experiencing if you have UTI? Symptoms include burning sensation on urinating, frequent urges of urinating, cloudy, dark, strong smelling urine, pelvic pain, which is very common in women, feeling of incomplete emptying of bladder after you go to urinate. And if the kidneys are involved, you will frequently or often feel having chills and fevers. You will be having back or side pain, nausea or vomiting, and severe fatigue, just to mention a few of the symptoms that you may experience if you're having UTI. The risk factors for UTI includes you being a woman. Because of anatomy, the urethra is short and also in close proximity to the back passage, which puts you at risk. The second risk factor is a postmenopausal age because of the hormonal changes that happens at that time puts you at risk. The other risk factor is catheter use. The other risk factor is urinary blockage, as in case of kidney stones. So when do one have to see a doctor? See a doctor whenever you are experiencing these symptoms and they persist for a day or two. Immediately you start feeling or experiencing signs of kidney involvement such as fever, back or side pain, nausea or vomiting, severe fatigue, or easily tiring. How is UTI treated? We treat UTI with antibiotics as prescribed by the physician always. Pain relief, which can be gotten over the counter, such as ibuprofen and other pain relief medication. So, what are the topmost five tips or good practices? Which now brings us to the five topmost tips or good practices to help us prevent recurring of UTI. Tip number one, always stay hydrated. Drink a lot of clear fluid to help flush out the bacteria and also to prevent creating a favorable environment for the bacteria to thrive. Tip number two, always stay dry. Invest in wearing handies which are cotton breathable handies and buy new ones as often as you can afford. The third tip is always practice good hygiene, among which you're supposed to wipe from front to back after toilet use. Fourth tip is to always urinate after intercourse in order to make the urethra patent and to prevent making that area favorable for growth of bacteria. Tip number five, always urinate as soon as you feel or have the urge to urinate. I hope it was brief and clear enough. See you in my next video and don't forget to subscribe.